This is Viterbi Voices, your chance to hear stories about research, classes, student life, and more.
Directly from our students, faculty, and other members of our engineering community. All right here at the USC Viterbi School of Engineering.
Hello, everyone, and welcome back into Viterbi Voices. I am one of your hosts. My name is Paul Ledesma, Director of Undergraduate Admission here at the USC Viterbi School of Engineering.
And my name is Audrey Roberts. I'm a junior studying mechanical engineering here at USC.
Oh, do we have an episode here for y'all
Yes.
today? This is another one of our alumni series, a continuation, and this one is...
With Dr. Jasmine Thum.
So Jasmine is a fantastic conversation. We were excited because she came to campus and got to sit in the actual quote-unquote studio with us.
Oh, yes. Paul's office.
Yeah, my office with random microphones. And Jasmine is super cool.
Yeah.
Jasmine's originally from Austin, Texas. And Jasmine came to USC to study biomedical engineering. She graduated with her... Oh, yeah, I forgot about this. She graduated with her Bachelor of Science in Biomedical Engineering and her Master's of Science. So she got her Bachelor's and her Master's in Biomedical Engineering in the same year. She did both of them in 4 years. So she graduated that in 2012. She then, of course, had to top that off by going straight off to Harvard Medical School. You know, no big deal. NBD. Goes to Harvard Medical School, has done a number of different fellowships, and is currently in her neurosurgery residency at the UCLA Neurosurgery Department. So we dug into a lot of information. We talked about the differences between neuroscience and neurosurgery and engineering and medicine in general. We talked about how she chose USC. We talked about what she does now. It was deep.
Yeah, this was a super fun conversation to be a part of. Here, Jasmine is just incredibly energetic, so driven, and you can really sense that. Just super great conversation and so much to learn too. She got into the science of it at a few moments. And it's really cool to just hear her perspective on what's important in medicine and what she cares about going forward. So definitely tune into this one.
Absolutely. Enjoy, Jasmine. Welcome.
Thank you.
That's for you too. That's your little
Are you serious?
Gift. Yes, and that's your water if you'd like some water.
No way. You know, this was always the best part of USC. There was so much free stuff. I swear. It was I had boxes just full of free things from USC. It was amazing.
Well, you should at least walk away with more.
Yeah.
Some more modern stuff.
Exactly.
Right?
Updated. I like it.
Yeah. Get your laptop adorned. Make sure the mug is. Because you're at UCLA now, right?
Exactly.
So you gotta represent.
It's true. It's true. It's a constant problem there. But yeah.
Well, Jasmine, thank you so much, especially for coming all the way to us. I really appreciate it.
Thank you.
And I think it was just kismet that we ran into each other at dinner. Mm-hmm.
Yep.
Was that just last week?
Yeah, I think so.
It was just
last weekend or something?
Yeah, last weekend. Yeah. So I was
Yeah.
ran into Jasmine at dinner Saturday night, and all of a sudden it's like, hey, what's going on? Hey, wait, hold on. We'll talk. It was just in passing. We'll talk, and then over LinkedIn, it's like, hey, you want to do the podcast? Yeah, okay, great. Here you go. And then she got it all scheduled. Of course, her first idea was, yeah, I'll come in on Monday. I'm like, I'm not going to be here on Monday. It's a holiday.
Yeah.
Yeah, I forgot about that.
It was the aggressive Jasmine that I remember, wanting to do something. Just let's do it now, tomorrow. I'm in on it.
Yeah, that hasn't changed. I guess it hasn't changed.
Well, why don't you introduce yourself to the listeners?
Sure.
Where you're from and how you got here, and the whole shebang.
Sounds good. So I'm originally from Austin, Texas. I went to...
That's right. I just had this flashback. You would wear a Texas necklace.
Yeah.
You were here. You had a state of Texas necklace, right? And you wore it every day.
It's true. I've changed over to pearls now.
I just had this flashback to that. I remember that Texas necklace.
It's true. I still have it.
Okay.
Yeah, in a little Texas box. It looks like a cowboy hat.
Everything has to be Texas shaped.
Yeah, it does, of course. I was from Austin, Texas. I went to a science math magnet there and was very interested from math and science from a very early age. And then as I was transitioning to college, trying to figure out what I wanted to do with the rest of my life, I was actually going in two different directions. I was thinking law or medicine.
Law or medicine?
Law or medicine. No clue why.
Well, yeah.
Yeah, because it's just, you're a high schooler and you're like, whatever, I'll just do something challenging.
Is that a family thing?
No, neither.
Really?
Yeah.
What do your parents do?
My mom, she actually just retired, which
Okay.
she's super happy about,
That's great.
but she was a computer science engineer.
Okay.
And then my dad, he currently works for Amazon, so he's like the head of econ there. But he does a lot of economic modeling and forecasting in general.
So still like academics.
Yes,
So
academics.
academic background. So
Yeah.
maybe it had to do with that. Had to be like that level, but not them.
Yeah, maybe. I don't know. Them, but whatever I was good at, maybe. Yeah. So, anyways, ended up like thinking the engineering, medicine sort of route. I think you remember maybe, but when I came in, I was still interested in medicine, but I wanted to do engineering because I really liked problem solving. I liked math. I liked what the skill set was that you
Didn't want to go
learned.
straight life science, but you're like, I still like this problem solving stuff.
Exactly.
And it's like, can I do that? Can I go med school and be in, like this engineering thing? But I don't want to be mom. I don't want to do that.
Exactly. So, gosh, I still remember when I came here for a visit, because we made a visit to the school when I was applying, and I met you, and you probably don't remember, but we were sitting.
I remember everything.
Steel trap, yeah, mine like a steel trap.
I remember the necklace. You got to give me points.
That
for
is really impressive.
Here's the thing. I remember little things like that, but I won't remember someone's name.
Oh gosh.
All the time. It's horrible. I just remembered Audrey's name like yesterday.
Yeah.
It just got in there.
You might remember it tomorrow.
Yeah, hopefully.
Maybe.
Oh, sorry, go ahead. So you come out for a visit.
Yeah, so came out for a visit, and it was so amazing how flexible you guys were and how forward-thinking everybody here was in terms of, you want to do medicine and engineering, you want to do dance and engineering, you want to do whatever and do it. Like, there's nothing holding you back. It was very different from all the other schools that I was looking at, very technical schools that I was looking at, which it was basically like, this is your focus, this is what you will do, you will not be a person outside of this will be your only track mission in life. I loved that. Ended up doing the progressive degree program here, which you guys let me squeeze into the 4 years, which was really nice of you.
Just telling Audrey that. I'm like, wait till Jasmine. She's nuts. She's like, wants to do everything. Like, I'll do the progressive degree in 4 years. I'll do that. And I'm going to go to medical school.
Crazy.
Sorry, we're getting ahead of ourselves. So where were we? You were visiting, and you loved that idea of just doing different things. And then you did biomedical engineering?
Did biomedical engineering, and then they had these different emphases within it. I don't know if they still do, but yeah. So it was more in the neuroengineering track.
Okay.
And so did a lot of that. Funny thing is, actually, there were such amazing classes that I took as part of the master's program, and even as the undergrad program, like the engineering colloquium, where they brought in all sorts of different speakers from industry and everywhere else. But I had a similar class as part of the PDP program, the progressive degree program. They brought in somebody who was working with, it was called Second Sight, or at least that's what it's called now. It's the occipital implants for basically making blind people see. And I remember I did some very basic visual processing projects with Norberto Grivitz, who is here. Yeah. And fast forward to, like a decade later now, we're actually implanting the first of those over at UCLA.
Really?
Yeah. And I'm getting like the data in my lab. So we have that in Dr. Paradian's lab at UCLA. So it's just super weird to see that technology come full cycle. And it just so happened that I'm at the institution that's doing it, like both times
And
at
that
the beginning
research
and
was
the
introduced
end.
to you here at USC.
Exactly.
Wow, that's amazing.
Yeah, super
cool.
small world.
That's neat. Wait, so let's put some years on things. You're here from what year to what year?
2012 to 2016. Nope, that's not right.
That's not right.
That was med school. 2008 to 2012. There we go. I know it's in chunks of 4 somewhere.
Okay, 2008 to 2012.
Right.
Is that really right? Oh, see, I can't.
Is that right? Yeah, no, I was
I don't know.
born
When
in
did you graduate high school?
2008.
Okay, good. So
Yeah,
2008,
so that's right.
That's an easier number to remember.
Yeah.
Okay.
Oh,
So
man.
you studied biomedical engineering for your undergraduate degree. Yeah, you did progressive degree also biomedical engineering? Okay, so a bachelor's and a master's.
So at the time when you decided to do PDP, did you know you were going to med school already?
Yeah, so I had actually sat down with Chris Knoll.
Still here.
Perfect. Oh man, I have to say hi to him. Okay. So I sat down with Chris Knoll. I'm sure that poor man lost so much sleep over me. And yeah. But I sat down with him before I even came in and I was like, look, this is what I want to do. Can we do it? This was before I started my freshman year. And the poor guy.
Again, that's aggressive jazz.
I'm so sorry. Chris, I'm sorry if you're listening to this. I'm so sorry.
Everything you tell me to do, I want to do 3 times that. I want to do it before you even thought about it.
That's good. I like that. That's good.
But again, in like Viterbi's spirit and USC spirit, he was just like, let's do it. And so he helped me figure it out. It was amazing. He just plotted it out for me. And he's like, if you can do this, this, and this, then you can get it done. And so that's what we did.
And so that's like, to put it into context for a lot of other people, the idea of doing that, a bachelor's degree and a master's degree, even through our progressive degree program, is squeezing in about sometimes 4.5, 5 years into 4 years. And you're prepping yourself for med school, which means that there's one particular year or a semester where that's MCAT studying and taking the MCATs, which is sometimes people consider a full-time job. Mm-hmm. What was that like?
It was... Time management was key. You know that I spread myself thin when I was here. Mm-hmm. I like to get involved in a lot of different things. And that was something that I really liked USC because it was a safe environment for learning what your limits were in many different ways. Mm-hmm. And I got involved in a lot of different things very early in freshman year, sophomore year. Paul sat me down, actually. I remember this conversation. And he was like, you need to figure out what's important to you. And it's true. You do. Yeah. And that's something that I've taken with me throughout my life. I think especially with my career, I've become more and more focused. And I still have that tendency to be interested in a lot of different things. So even within neurosurgery, I'm very interested in many different things within the field, but I've had to, again, focus. My research needs to align with the patients that I want to see, things like that. Mm-hmm. So taking that to heart moving forward. But kind of going back to, what was the question again? Am I answering a question?
I don't know.
I don't know.
I don't know what to ask. I think what I'm trying to get at is like, so how was that time here? How was that? Because you're trying to get into that. How was that doing all of that compacted academic work? And then you were reading between the lines of my question, which is, what else were you doing? Because like you had a full life, and so let's let people understand that.
Yeah, so I was involved in a lot of different organizations on campus. I was in the Viterbi Student Ambassadors, which was an amazing experience. I loved working with the incoming students. I'm sure you do too, Audrey. Yeah. It's a lot of fun. I was part of the Biomedical Engineering Society, the Society for Women Engineers. I started my own organization when I was a third year to basically help fund these projects that we did from writing 340.
BME START, or is it right?
It was, at the time, it was called something different. It was called HOPE at the time.
Okay, and then that evolved into that, that's right.
And so it was the idea that you didn't want to just let these projects sit around and get unfunded that were otherwise very good ideas. So I did a variety of different things, but I think what it came down to in the end was figuring out what was most important to me and what I really needed to focus on. The MCAT was important. So you make time for the things that are important to you. And I actually took the MCAT kind of early as well. I think most people take it as a junior, senior. I took it as a sophomore just so that I could sort of get it done, get it out of the way. And so I just sat down and cranked. And I think, you give up certain things. You don't go to as many football games that year maybe as you otherwise would have liked to, but you make up for it on the back end, and you figure it out.
That's awesome. So cool. So did you know, I'm just kind of curious, getting the master's, were you sort of interested in a specific application since you were so clear on kind of like an academic path going forward almost, or was it just an opportunity to take more advanced classes for you?
Yeah, why the master's?
Yeah, I think it was to delve deeper. So as a biomedical engineer, I felt kind of like a jack of all trades. And I really wanted to get more concrete skills in some ways. And so I focused very much on signals and systems processing for different types of signals, whether it was, cardiac signals or neural signals, whatever it was. I essentially was getting better at the computer science side of things, computer science applications to biomedical engineering. And that's what I wanted to gain. And I also wanted to see more of what was out there. I mean, technology is evolving at such a rapid rate right now, and I can see it in neurosurgery as well. There's a certain subspecialty of neurosurgery called functional neurosurgery where technology is just booming for all sorts of applications. And sometimes you just don't know what you don't know, and you need somebody to say, hey, this is a door leading to this whole world. Have you ever considered it before? And I feel like I got a lot of that exposure and my brain started to think in a different way when I did the master's. So I think it was in part to get some more technical skills, but it was also in part just to see what was out there and to open my mind to the possibilities and basically hear from people who, you know, it's really hard once you leave school. You never really get to be exposed to greats in the field after that point, except for what you're in specifically. You know, I've been going down this whole podcast binge recently as I drive to work, and I'm trying to like learn things about other fields that are not my own, or read different books and stuff like that, or listen to things at the gym, trying to become more worldly. But it's hard once you leave school to continue to, if you're in a very specialized field, to continue to learn broadly, which again was something amazing about USC is that they really, really foster you as a whole human being. And I think I took that forward, that love of just differentness, otherness, other experiences in the world, things like that.
That's awesome. So with like the master's classes, the bachelor's classes, that's a lot in 4 years. Did you have time to take sort of the fun other classes that you mentioned kind of being interested in USC for?
Yeah. I took actually that film class, the one where they do the showings, you know, every week or whatever.
466.
Yes.
Yeah. I don't remember the numbers.
Thursday night at the movies.
Exactly. Yeah. That was a lot of fun. I really
do you remember any of the movies that came out that year that you watched?
Oh, gosh. I'm trying to remember. This would have been 2000. I think I took it in 2011 or spring of 2012. I think I took it end of 2011. There was some horror movie that I watched that just scared the I can't say that word on here. I remember that. I don't even remember what it was because I don't think I watched the whole movie. I think I had my eyes covered most of the time. Yeah. I remember that one very vividly, and I think that actually colored my entire.
I can't watch horror movies. I can't.
Yeah, I
don't do it.
I went to a premiere for a horror movie the other night, and it was just. I don't know why I do this to myself. I don't know. I don't know.
Why do you keep going?
It's unclear.
Oh my gosh.
Anyways, sometimes you think you'll like the thrill of it, and then you
Right.
get there and you're like, no, I really no. I was just sitting there eating a lot of popcorn and pretending like I was looking at something else. Anyways, yeah.
Oh my gosh.
So I took that class. Let's see, other fun I took swimming.
Wow.
So I swam in high school and I took a couple credits of that. It was a lot of fun, just a good like stress reliever. I'm trying to think if there are any random classes I took. Like I said, the engineering colloquium was a lot of fun. I liked that too.
Yeah.
I never took like a dance class or like music theory or something like that. I feel like that would have been interesting, but I just didn't have time.
Well, USC didn't have Kaufman at the time, right?
No, but there's still dance classes.
Okay.
Yeah, but we didn't have the big thing. Yeah,
The
dance
school.
studio.
We didn't have the
and
school of
everything.
dance. Dance was part of the theater department.
Oh,
Right.
interesting.
Yeah.
Cool.
And then I went to Honduras. I remember that was a lot of fun as like a medical mission when
Awesome.
I went for 2 years. That was a lot of fun. I didn't get to have a full abroad experience like some people did, which again, so amazing that that's like built into the curriculum here. Unfortunately, I couldn't take advantage of everything that was offered.
Well, you did like 12 other things. I mean, like it's like, well, I couldn't take advantage of that. I'm like, glass is always half empty.
Yeah, but no, I did. I was able to take advantage of a lot. That was like the one thing.
I know.
Yeah,
No,
that was like the one thing.
there's always those regrets of like, you never regret things you do. You always regret things you don't.
Exactly.
And specifically in college, you can look back and be like, you know, I never did that. And it's not a bad thing. It's just like, oh, you never like pulled that trigger, or like at the time it was just there was other things happening. Mm-hmm. It wasn't because of like this vacuum. Like, it was just you were filling that void with other things.
Yeah.
It's true.
So you go from USC, you graduate in 2012 with a bachelor's degree and a master's degree in biomedical engineering. And you go to medical school, and where do you go?
I went to Harvard for medical school.
Harvard Medical School.
Yeah.
And what was that like? I mean, I think that there's TV shows based on Harvard Medical School. Like there's a lot of lore around Harvard in general. In one of our other alumni interviews, we had Harvard Business School.
Yep.
And so one of our first
questions
question was like, let's break that down. What's it like?
It was fun. It was a lot of fun. Boston is cold. Boston is extremely cold. So the program that I went to, there's 2 programs at Harvard for medical school. One of them is, gosh, I don't even know what iteration it's called now, New Pathway, something like that. It's more clinically focused. The other one is Health Sciences and Technology. It's more research focused. And that's the one that I went to. Really small class size. There's 30 of us every year. You basically sit there. They take attendance like you're, in 5th grade. But it's great because we actually
assign seats.
Yeah, exactly. We self-assign our seats, but it's funny how that happens. You go into an auditorium enough times and everybody just keeps on sitting in the exact same spot all the time. Yeah. So it was a lot of fun. I liked it a lot. It was great. You were exposed to really amazing lecturers. So a lot of what the curriculum was based around, it was a joint program between Harvard and MIT. And the idea was you were supposed to bring in research concepts or themes to almost every single lecture that we had. So it wasn't just purely medical based, purely clinical based. You do a lot of that learning that you need, because for medicine, you have to take a lot of board exams. There's like 3-step exams that you have to take for medicine, and then you move on to your specialty and you have to continue taking exams basically for the rest of your life. For that, you had to do a lot of that education outside the classroom, but in the classroom, it was very focused on, again, just expanding your horizons, seeing what was out there, how you could contribute as a researcher, like as a physician scientist is the term that we always use, in the future. A physician scientist. Yeah, it sounds very fancy.
Cool. That's cool. I like it.
In the future. And so, it was a bunch of, the 30 of us were goofballs. It's not like as pretentious as you think, or like we all just complained about the weather, and then we just went to anatomy lab together and poked around, and it was good. It's just,
I like you just described Harvard Medical School as basic. Just hanging out, anatomy, poking around.
No, it was amazing. It was phenomenal. I will say the anatomy class was truly amazing. We had this neuroanatomy class and we had this general anatomy class taught by one of the people who taught the anatomy class. She's this lady who I will forever remember. Her name is Trudy, and she knows everything. So she knows everything about animals and their anatomy all the way to like humans. And it's very odd to hear about like the uterus of a horse and comparing that to the uterus of a human being. Very strange comparisons. Paul's giving me this very strange.
Tell me more. Like, you can't tell me it's fascinating, then not tell me more. Like, now I'm curious.
I don't even remember what she said. I think when she started the comparison to a horse uterus, I was just so taken aback that I blanked out on everything else that she said thereafter. But the fact that she even knows what the differences are to start a sentence like that was just fascinating to me. So I also wasn't being tested on horse uteruses, so there's only so much information I can keep up here, Paul.
Is it on the test now? Okay,
But anyway, no, it was great. It was a wonderful experience, and I met some amazing mentors there. I think a lot of my journey through academic medicine has been, and just academia in general, has been punctuated by these amazing mentors that I've had. When I was here, Dr. Koo, who is still in the biomedical engineering department. Yep. So I'm actually going to go grab lunch with him probably.
Oh, great. That's great.
That's awesome. Yeah.
But he was very instrumental in my career. And then when I went to Harvard, there's a gentleman there. His name's Emory Brown, just the coolest guy you've ever met in your life. Very laid back. He wears a baseball cap backwards all the time, but he's probably the smartest man I've ever known in my life. I don't know why I had to qualify that with a but. Those two are not, mutually exclusive, but it's very off-putting when you see that and you're like, oh my gosh, you know so much about everything. So yeah, when I went there, and then I eventually made my way back to Los Angeles. So now I'm at UCLA and I'm doing my neurosurgery residency. 4 years in now. It's been a lot of fun.
So explain to us would you classify yourself now, or is it when you're done that you're a neurosurgeon?
Yeah.
And what does that mean? Like, what does it mean to be a surgeon? What does it mean to be a neurosurgeon? What does it mean to be a neurologist? What does it mean to have?
That's a great question.
You know what I'm getting at? Like all these little terms.
I do.
And we have so many students that come into biomedical engineering and they're like, yeah, no, I really have this interest in like neurology.
Yeah.
Cool. I get it. Like, but for some reason, that term in particular,
Yes,
is always one of what biomedical engineers can be like. I like to study biomedical engineering, but I have a real passion for neurology.
yes, definitely. I don't think we even know what we're talking about when we're that age, and which is what you're getting at, of course. But
I didn't say that, but I'm just saying, like, help enlighten that future path of what that means.
Of course,
taking a neurology, basically, you take a class that focuses on neurology.
Right.
It's fascinating,
right?
And I think that's the idea,
right?
It's like when people come to me and say, "I love psychology." I'm like, "You like psychology 101?"
Right. Exactly.
It's a big difference between Psych 101 and all the rest of the classes that come after that.
It's true. Oh no, that's also an interesting distinction between psychology and neurosciences.
Thank you, neuroscience. That's the word I was blanking on, not neurology, but like neuroscience is the one that they come in. It's
right.
Like, I'm like, okay.
Right. So, where psychology is more the science of the mind and understanding what it's based on primarily theory. It's more, I don't want to say abstract because there's definitely concrete theories that people have about theory of the mind. But neuroscience is really the nuts and bolts, like the biochemical side of the brain works. Yeah, exactly. It's understanding the electrical, and there's so many different components of it too, right? There's understanding how it works on the most basic, neural level, where you're looking at the molecules and the channels that are opening and closing and what creates the action potential. And then you go to this larger scale of, okay, now that we know how a neuron fires, how does this neuron communicate with another neuron nearby it? Is it excitatory? Is it inhibitory? How does that change the circuit? And then looking at the entire systems level of how different parts of the brain communicate with each other. Then you get into a little more abstract things of, well, what do we think these different signals, these different frequencies of communication of these neurons, what do they mean in different parts of the brain? And that's actually, it's funny we're talking about this because last night I was sitting in front of my computer. I feel like I'm back in undergrad, just like sitting there coding, all night. So I was sitting there in front of my computer, like coding and waiting for some of my graphs to pop up, because I'm in a research year right now. Mm-hmm. And I'm trying to understand the neural circuitry that's involved in consciousness. And so it's a big leap from where we're at right now, understanding, okay, how is this neuron communicating with this other neuron, to what is the entire circuit for consciousness? How can we intervene on it? And how can we basically stimulate certain parts of it to wake people up who are unconscious? So working on that long-term project, obviously doing small portions of it as I go. And it starts blending at a certain point with general, psychology, if you will, general neurosciences. There's a point at which things can be mathematically modeled and proven, and then there's a point where we just don't know. And I think that's kind of a gray zone. But I'd say in general, the neurosciences is things that are, proven, mathematically modeled, things like that. They're very grounded in, quote, science.
It's just complex too, like neural networks and how the brain works. We don't.
Right.
Like, do you think we're ever going to know exactly?
I think, part of the biggest problem is we need to be able to measure all these things safely in humans. And the nice thing is that now there's a lot of FDA-approved devices that you would use in patients just for normal pathology, like Parkinson's disease or essential tremor, things like that, where we stick these probes into the brain, basically these deep brain electrodes, so we can stimulate parts of the deep brain and we can actually stop them from having the tremor and things like that. And so the nice thing is now, as technology is advancing, not only can you stimulate with these electrodes, but you can record from them as well. So you can tell how the neurons are chatting with one another, basically, in these deep structures, which we otherwise have not been able to access in the past. And then if we put more electrodes on the surface of the brain, because we already have a small portion of the brain opened in order to do, the skull open in order to do these surgeries, you can put additional electrodes on there to try to understand how different parts of the brain are communicating with one another. So, we're slowly getting more and more nodes that we can measure at the same time. For people who have epilepsy, for instance, seizures that are uncontrollable, when we're trying to figure out where we're going to remove tissue from the brain that's causing the seizures, we'll oftentimes put in a lot of these deep electrodes into different parts of the brain. So then we have a lot of different electrodes or a lot of different nodes that you can use to basically understand where the communications are coming from and going to. And you can use a lot of different types of analysis to understand causality and flow of the information. What's important, what's not important. But it's still not there, obviously, at this point. And it is exciting, though, to see where it's going to go. All of this is still used in patients who have some sort of pathology. They have something wrong with them, and there's a benefit to us doing these surgeries for them. In the future, I don't know that we're necessarily going to, just because of the medical legal landscape, I don't think we're necessarily ever going to go to a place where we can do this in people, volunteers, who just have no pathology and just want it
Crack
done.
my skull open.
Yeah. Although there is, as these things get smaller, as these electrodes get smaller and smaller, they become less and less invasive. You kind of wonder where things will go. And that's the other thing that I've learned is, again, you should never close your mind to the what ifs. You should always keep it open. Always think, well, you know what? If we did it this way, which is so far from the norm of how we usually do things in medicine. And medicine is, a very regimented field.
Sure.
There's a lot of protocols that we follow. It's very slow to change for patient health purposes, things like that. But putting all that aside, taking on my engineering brain, my problem-solving brain, my sense of wonder. If we think about things in a completely different way, if I was given this problem and I didn't have the constraints of medicine and medical legal practice and all of that, how would I approach this? And you think about it in that setting, I could see ways where we could potentially continue to improve. And then you'd, of course, have to bring that back to reality, which again is a lot of what an engineer does, right? They are given a problem and they're told solve it, and you come up with all these crazy ideas, and then you have to actually fit it within the physical constraints, within, the anatomic constraints, within the chemical constraints, whatever your particular major is, that's the box you have to fit it in, right? And so it's, I think that things will continue to progress, and as we're able to meld technology with neurosurgery. So that's to, I guess, clarify what neurosurgery is, since you asked it before. Neurosurgery is specifically surgery on the brain and the spine, and it's ranging anywhere. It's not the medical side of things. That's neurology. So they deal with all of the medications and things like that. So neurologists are... they'll deal with all the medical issues, and then the neurosurgeons are more like the mechanics. So we'll go in there, and if there's a plumb that needs, clearing out, that's what we'll do. So essentially, once technology becomes better and better integrated into medicine, and we're more open to it, I think that it'll open a huge number of doors for patients in general. But
incredible. It really seems like, too, kind of all the interests you mentioned having almost your whole life are really coming together. I'm thinking like signal processing has to be a huge part of it. You kind of get the law in it as well. So it's cool to really be working, like as a doctor, a surgeon, and engineer kind of all at the same time. It sounds like it's great.
You mentioned that you're in a research year of residency.
Yes.
And you mentioned programming. And so I want to see if we can unpack that a little bit. Like, what are you programming? How are you programming? What to a high schooling student? It's like, oh, is that like C#? Like what you making a game? Like what's going on here?
So I actually like to use MATLAB. I think a lot of people in my field will use MATLAB or Python. Those are the two. It just has a lot of really nice built-in signals and systems processing toolboxes that I like to use, especially for neural signals in particular, like EEG, local field potential type signals. So I use MATLAB. I basically get a lot of data that comes from, so local field potentials essentially is what I'm measuring from the brain. We get those signals from the surgeries that we do, and we record them, and then we take them to the lab, and we just do a lot of processing on the back end, take out all the noise. We have to then basically understand how the power is changing in these different signals, and coherency is another thing that we measure. Causality is something that we measure. So just, programming all that in. It's a lot of math that you're just converting into basically a programming language so the computer can do it for you, because I can't do that. So my computer is still running my code from last night. So
Really?
yes, it was. So it's just a lot of data. It's just a lot of data. And it's going to be interesting when machine learning becomes more easily accessible for medical use as well. Yeah. That's the amazing thing about being at a university type institution, is that there's so many people from so many different backgrounds who all have their own specialties and their own expertise. And even though we're getting more and more siloed, it's because it's for a reason, right? It's because there's so much to learn within each field. And then in a university setting like USC, you can bring all these people together and you can make these amazing discoveries when you start talking to one another. So I was talking to a friend of mine who is very interested in machine learning. This is over at UCLA. And he actually went to USC as well for undergrad.
Cool.
Yeah. We took a similar course. We both went out to Harvard. He did an MBA there. Yeah. Then he came back out to UCLA and is doing a PhD now.
Wow.
Yeah. Very strange. Very.
Where's he from?
He is originally from Ohio.
Wow.
Yeah.
Cool.
Yeah. So anyways, we were talking about machine learning, and I was thinking, gosh, basically you need a lot of data for machine learning to be useful and for it to grab any interesting trends. That's definitely what we have. We have so much neural data, just in terms of the amount of time that we record from these patients and just the number of channels that we have. It would be so perfect. I don't know how to do. I don't know how to do that. I don't know how to do machine learning. I don't know how to code it. But if that became more of a regular practice, there is so much medical data out there that would lend itself so easily to this, you know. So I'm excited to see where that goes in the future. I know that there's already people working on this. I talk to my dad about it all the time, because he's also very interested in machine learning. And he used to work a lot with autonomous vehicles and predicting what's going to be happening with them in the future. And he uses these very complex models as well for his own work, or he used them for his own work. And so we just, it's my dad, I'm just springboarding ideas off my dad in no particular formal way. But I'm sure moving forward in the future, that's kind of something that I see myself getting a little bit interested in is where that's going to go with things. So. Anyway.
When is your residency over?
So it's 7 years. It's the longest residency. And then after that, I'll probably end up doing a fellowship. So 1 additional year of training in my specific subspecialty. So there's 7 subspecialties within neurosurgery.
And that'll be all here at UCLA, or you don't know where that fellowship is?
I don't know about, where the fellowship will be yet. So I probably will start applying end of this year, beginning of next year.
Wow.
Yeah.
Cool.
So then could you still go in, you kind of talked about how at Harvard you were more in sort of this research technology program rather than full sort of clinical or clinically focused. Could you still kind of go into more of an academic research field or more clinical at this point? And do you know where you want to go with that?
Yeah. Definitely at this point, I can go either direction with things. And I think, in the two ends of the spectrum would be I'm a spine surgeon who is mainly doing a clinical private practice, and I'm seeing my own patients, running my own business kind of thing. And that would probably be a little bit less on the research side just because you don't have the same access. On the other end of things, I would be, a functional academic neurosurgeon. So this is, again, somebody who takes a lot of who does a lot of the epilepsy surgeries, who does a lot of the motor, helps with these motor disorders that people have, different pain problems that people have. Different peripheral nerve problems that people have. And I'd be at a big academic institution doing research on the patients that I'm seeing, and being at a place like USC, UCLA, some of these big Harvard places like that, where they have the support and the infrastructure to do that kind of thing. Because again, it takes a lot of cross collaboration to be in that kind of a field. So for me specifically, I'd like to be on that side of things. That's where I see myself going in the future. But you can run the whole gamut for neurosurgery. You don't have to just pigeonhole into just academia or just a private practice model. So.
Right. And is that one of the reasons you chose neurosurgery, because it has such a range of, I guess, professions? I don't know anything about how medical school or that track works. But
That's totally fair. That's totally fair. I don't think I even realized that neurosurgery had 7 subspecialties, even when I was applying to med school or even when I was in medical school. You know, I think I learned that at some point in medical school, that there were 7 subspecialties within neurosurgery. I was like, isn't that specific enough? It's not, apparently. Yeah. So whatever. I think that I chose it initially because I had a strong interest in, Paul, you're going to hate me, the neurosciences.
I don't hate anyone like that. No.
And how the brain works, essentially.
I think to me, let me correct if that was interpreted
wrong
way earlier. No, just anyone that's listening. I think what it comes down to is that it is not skimmed, but it is a kind of a cursory look at something. It's like, wow,
correct, yeah,
this is so complex. I want to learn more.
Right.
Anything involving neuroscience or the brain. Yeah. And so it's like, oh my gosh. And like computer scientists get fascinated by it and biologists get fascinated by it, and people with interest in psychology get fascinated by it. It's like the brain is this one spot where everybody goes, the minute they learn a little bit, they're like, oh, there's a mystery.
Right.
There's so much more I want to learn about that.
Right.
And so there's just constant unpacking.
Right.
Of information. And that's why I made a joke earlier that like so many people just have this like cursory interest in it when they come in from high school.
Oh, for sure. I would say that even at my stage, and I'm not all the way along, I still have like a cursory understanding of it, you know, because there's just so much to know. There's so much that we don't know. But yeah, so part of that I think is just a reflection of our general lack of knowledge in the field as a whole. But
as you go into you're kind of going into the sunset of your official academic range.
Correct, yeah.
And I know you're going to constantly be learning and testing and stuff like that, and that's kind of a lifelong learning thing that you have to do. But as you go into like the beginning of your professional career, different than like where do you hope to go, what do you hope to do? Is there something in your field, is there like a holy grail of something that you all talk about that like, oh, once we solve this or once we do this, it's going to change the world? Or is there something that you are, some sort of disorder or something that you're like, that's really interesting to me, I want to see if I can figure that one out?
I think there's 2 that I think about.
Okay.
So one is this whole idea of a brain-machine interface, right? Like basically a chip that you can implant into somebody's head, and it can replace a faulty circuit, essentially, right, in the brain. There are so many disorders, neural disorders, that are due to faulty circuits in the brain or a faulty part of the circuit in the brain. And if there's some way that you can replace that, or you can stick a probe in there and, you know, modulate it or bring it back to life somehow, that would be, you know, it was the same technology and you could just put it in different parts of the brain. That would be a holy grail. That would be amazing. So to do something like that. I think the other thing would also be, you've maybe heard about like immunotherapy for tumors, for brain tumors. So basically having the body fight off brain tumors. I think that's really, really interesting as well. It's a very interesting concept. Actually, the chair at my program, Dr. Linda Liao, who's like one of the only female chairs in neurosurgery. There's like 2 in the country or something. She's a phenomenal woman, like just absolutely amazing, amazing role model for me. Because it's hard to find female role models in neurosurgery. So she is working on this. And I think that if that's something that we could reliably use in patients, that would be extremely, extremely helpful. Or if we could even, you know, this is really getting ahead of myself here, but like, I don't know, gene editing is a fascinating concept. There's obviously like a lot of social and ethical questions around it.
Firestorm of a conversation.
Yep, definitely. So I won't even really.
Safe place. This isn't going
us anywhere. And all the people that hear us. But
objectively on the outside looking in,
like exactly.
If you take it like from that problem solving perspective that you talked about, the engineering brain, like what if we could just like flip the switch? What if we could scrub that a little bit? Exactly.
For these different pathologies that people have, you know, if we could get rid of brain tumors, that would be that would be amazing. It would actually put a lot of us out of a job. So, I'm sorry to all the other neurosurgeons out there who I just said this to, but yeah, it would, that would be a game changer as well.
Yeah.
So those are two things. And, given that there's 7 subspecialties in the field, there are probably other people who are out there saying like, no, if we could fix like the degenerative back, in the elderly population, that's really where it's at or something like that. Basically figuring out ways so, people are more back conscious, more back healthy, things like that. Then, that. But in terms of where I am with things, I find those two areas fascinating because I think, again, it's the intersection of technology and the human body. And I think that's where things are going in the future. And I think that's where there's a lot of excitement and a lot of possibility.
So, sorry, what is your subspecialty then?
So it's what I want to go into. So right now in residency, I do everything.
Okay.
But so there's like pediatrics, there's tumor, there's
Like a rotational thing?
Yeah, exactly. There's skull base and vascular and spine, trauma and functional, which is what I'm interested in. So functional is very much a catch-all term. It has to do with improving patient's function, which again is a catch-all description.
Like, and the rest.
But essentially components of it are so movement disorders or anything where you can basically stick a probe into the brain and fix. So they're starting to do this for OCD, or it's been approved for OCD.
Wow.
You can do it they're looking at depression. They're looking at overeating or impulsivity disorders. So basically just sticking a probe into different parts of the brain and stimulating in a certain way and getting rid of these behaviors or curbing them so that the patient can function better. I mentioned epilepsy before, kind of goes under this as well. So there's all sorts of different surgeries that kind of encompass epilepsy. And they're different in kids than they are in adults, but epilepsy also kind of goes into functional as well in some regards. There's also peripheral nerve, so any tumors or anything like that grows out of the peripheral nerves, any trauma to the nerves, you can do these procedures basically where you reconnect different parts of the nerves to one another so you can reanimate a certain part of the body. So that all, like improving their function, that all goes under functional basically. Okay. So yeah, broad term.
A lot. That's awesome.
How far away are we from non-invasive the surgeries for those types of things? Like, I'm magical medicine in the future. This idea of like, I'm going to go in for my my OCD probe this morning, and it's just like quick up the nose, and we're done. Like, I mean, I don't think it's that quick or easy, but like, how far away from that?
Yeah, no. So I mean, for deep brain stimulation, it's not. Okay, I'm going to say this and people are going to cringe. It's not that invasive compared to what we usually do.
Cutting a hole in your skull.
It's a small, what we call a burr hole. It's like a quarter-sized hole that you make in the skull, and then you stick the electrode in. And so technically it's not as complex as other areas of neurosurgery.
Sure.
The majority of it is in the planning and patient selection and the research side of things. That's where the majority of the interest in that field is. There's other types of surgery that we do, like skull-based surgery, where basically you're going in through the nose with a camera, or you're going in through the back of the head or through the ear or next to the ear, and you're drilling a lot of bone away, and you're trying to avoid all these nerves that are coming out of the brainstem or these different vessels that are coming out at you. It's very technically complicated. So this isn't that, but it's not non-invasive. There are other technologies that are arising. So there are different things, like focused ultrasound, for instance. We've always had lasers, or not always, but lasers are something that we use, just a common layman term, for trying to treat a variety of problems that the patient has. It's still not something I would consider non-invasive. You're still ablating tissue, you're still burning tissue, things like that. But you're not always necessarily making holes in the skull. So focused ultrasound is another one where basically this is becoming more and more popular, or there's more and more interest, I guess, in it. So it was presented a decade ago, maybe longer, and then it was kind of shelved. But you can put a cap on the patient's head. You shave their whole head. You put a cap on their head. But that's the most invasive part. And then, there's a whole bunch of ultrasound probes essentially that are built into this cap, and they can focus the energy on a certain part of the brain, and they can ablate that tissue, or now they're actually looking at how they can modulate the tissue. So not a permanent ablation, not permanently destroying the tissue, but just changing how it's responding. Wow. And so moving in that direction, I think, is definitely an interest within the field. And there are some technologies that will potentially lend themselves to that goal, that overall goal. But then it becomes a question of which patients, again, do we select for these types of procedures, and how do we make sure moving forward that they work better than the current technologies that we have. So it's moving in that direction. And I think that it will get to a point where there will be a good patient population for these types of procedures. But again, I would caution anybody who hears this and thinks that it's non-invasive. It's still invasive right now. But
so these what you call the common burr holes, or like the burr hole thing, right? Uh-huh. What's the recovery like? To a patient, I just got you just drilled my skull open. you fixed something in my brain. I'm imagining it's not a Band-Aid that I'm walking out with, but it is a small hole. And what's my personal recovery? How do I feel? How long does that take? And also, does that skull grow back? And how often or how long?
Yeah. So for just the burr holes, like the quarter-sized hole that we make in the skull, basically, they go out the next day oftentimes. So we'll do the procedure, and then we'll get a quick image of the head afterwards to make sure everything looks hunky-dory. And that's the technical term, by the way, hunky-dory. And
it's a stamp you got.
Exactly.
Hunky-dory. Get on out.
And then, and then they head out, and there's basically just a small incision, maybe, depending on the resident and how big they made the incision to begin with, maybe an inch or so, not very big, on the head. And it'll just be sutured up, and they just get the sutures removed in 2 weeks. That's probably the most difficult part of it all. But yeah, for these patients who have these leads that are placed into their head, there's oftentimes there is a wire that goes down to their chest. So it gets tunneled through the, just underneath the skin of their neck, to their chest. And we put a battery pack there. And again, battery packs are getting smaller and smaller and having longer lifespans.
So is this something that then the sensor stays there, or do you, oh, wow. Okay.
Yeah. Oh, sorry. I'm nodding my head. Sorry. You can't see that on the podcast.
Great for radio.
Exactly. So the electrode will stay in their head. And of course, you have to worry about anytime you place any sort of object into a patient permanently, like a foreign object, you have to worry about infections and things like that. So that's something that we worry about. But otherwise, they'll stay in there.
Okay.
Yeah.
And is it removed after years or months? Or
yeah. So for these patients, we'll usually, if we can, we'll keep the electrode in for as long, unless there's not a fracture or an infection or something like that, then that part will stay in forever. We won't mess with the brain part from that point going forward. Or if it's not working for them, like the device isn't working, because there's different ways that you can program it from the programmer that's on their chest, the battery/programmer on their chest. And if it's, something fails, it's not working, whatever, then that might be an issue too that we need to address. But the main thing that we change out is just the battery. And so, it used to be 5 to 7 years. It's getting longer. And it depends on how frequently they're using it. But yeah, that's mainly the part that you have to change out.
And are these devices made by a medical device company, or is it something more at the research phase?
No, so all of I remember, the career fairs here were amazing. I remember when I was in undergrad. It just draws everybody.
Next week.
Really?
Yeah.
Okay, everybody should go to that. I went and I wasn't even interested in going that route, or I wanted to keep my options open, but I was pretty sure I wasn't. So it's just so amazing the number of companies that are drawn here and drawn to the talent at USC, the undergrads and the graduates and everything. But all these companies that you hear about, Medtronic, Abbott, Johnson & Johnson, all these different places, they all have different systems that you can use for all of this. And so a lot of it is on the industry side, but there's definitely a lot of research in the background R&D that, biomedical engineers are going into. In fact, I know some of the biomedical engineers my year went and worked at some of these companies as well. So, yeah.
Absolutely. And they all still recruit.
Yep.
Yeah. So did you ever think kind of along your path, of course, so you have 4 years of medical school, 7 years of residency, 1 year of fellowship. It's a lot of school.
Are you just rubbing salt in my wound right now?
I know, I'm sorry. But you're so close. But did you ever think like, wow, like I have a master's in biomedical engineering, I have a bachelor's in biomedical engineering, like, I could probably just
go straight to industry.
Go straight to, one of those companies. Like, how was it kind of pushing yourself still towards this goal when you had like 2 great degrees already,
Honestly, it was just my sheer curiosity. I really, really was interested in working with my hands and directly changing patient outcomes. And I love the science side of things. I love the engineering side of things. But I felt like if I just went that route, I would be missing something. And I felt like with this route, I could still have maybe not the best of both worlds. You can't do everything, but I could definitely have part of both worlds. And I think that in some ways it is nice to think like, oh, I could already have a job now or whatever. But I don't know. I just love what I'm doing right now. I'm so excited. It's the kind of thing where I get up and I'm like, God, I say this to my co-residents all the time and they kind of roll their eyes. We're so lucky to be doing what we're doing, that we get to interact with patients in this way, and that we get to do these things to people, to other people, to help improve their lives. And it's just such a special position to be in, and I'm very thankful that whoever the heck believed in me, and that I was able to get here. And, I still have a journey ahead of me. And I'll be thankful to all the patients in the future who let me operate on them. But it's just such a unique and special role that I felt like it was something that I didn't want to second guess. Now, are there long days you're there in the hospital for like 24 or 30 hours, something like that? You haven't left. You smell like what you smelled like yesterday, but worse, because you just haven't left. And you're just like, man, I would like to sleep. I think that's the biggest thing, right? Is the sleep component. We would love to get a little bit more sleep in our profession, probably as a general rule, but it's still worth it. It's still totally worth it. And I remember the first surgery that I saw. So when I was in undergrad, I had an opportunity to go and see this was end of high school. I had an opportunity to go see a surgery, and I was blown away. You're one of these people who, when you get to medical school, you either get to the operating room, because you have to do a rotation in surgery in medical school. You get to the operating room and you either pass out right away, which, okay, fine, maybe surgery isn't for you. You're like constantly looking at the clock and you're like, when is this going to be done? Or you're the kind of person who's just like, you're just staring at it, kind of like a deer in headlights, and you're just like, this is amazing, this is so cool, and you're thinking in your head, I can't wait to do this, and then you're constantly like bringing your hands back because you're like, I'm not supposed to be doing this right now, but I really want to. So that was me, and I think that's what a lot of surgeons are like, and just the hands-on physicality of it it's just unique. It's just different. So.
That's great.
And along this path, you got married.
Yeah.
And so when were you married?
Oh gosh, this was almost 3 years ago now. So it was
ago.
my intern year. Yeah, my intern year of
That's awesome.
residency.
And so that was here?
That was here. Yeah,
Okay.
We got married here.
Wow, very cool. So you went from Texas to LA to Cambridge. I think you had a couple of pit stops, or did you go straight back to here?
I went straight back then after that to UCLA.
Why did I see you in Texas that one time? Did you just happen to be there?
Oh, I was there for a conference.
Oh, that was just weird. That
Yeah,
weekend?
it was just very weird.
Because I'm like, wait, no, she was in Texas for a while because we met up in Dallas.
It was, yeah. I just happened to be there at a conference, and I think I saw you in Boston one time too.
Yes, you did.
Yes, yeah.
I'm like,
Crazy.
I don't understand because I met your husband the other night.
Correct.
I mean, and again, I apologize to your table because we were the rowdy table 30. Not to.
They were having fun. They were having a lot of fun.
Yeah, we were. I don't want to. It was a nice restaurant in Beverly Hills, and everyone's like, tables of 5, tables of 6. We're a table of 30, and it was a little rowdy, and so I was like, I'm sorry, we're leaving. The restaurant wanted us out of there pretty quickly.
Fun. It was very funny. Yeah, it was the weirdest thing. We were there for my mother-in-law's birthday dinner.
Oh, so now I really feel bad.
No.
Because I didn't pick up on who the table was. I was trying to get out. I was trying to say hi, but get out of the hair quickly.
Yeah, we were sitting there. We were right next to them, and somebody made a toast, right? Somebody was making a toast or something.
It was my friend's birthday, and
Right.
he was thanking everyone for coming. Yeah.
Right. Yeah, it was very nice. It was a very sweet toast. But I look over, and it's one of these things where, you're like looking over, your eyes kind of scan. Interesting things about eyes is that, you always, it's like an evolutionary thing to catch other people's eyes. So when you're like awkwardly looking around and somebody like sees you staring at them, it's not really your fault. It's just like evolution.
No kidding.
Yeah.
To know.
That's awesome.
So anyways, but I was looking around the room and I like saw somebody and I was like, oh, whatever. And then you like do the double take and I was like, oh my gosh, that's Paul. Like, I think I saw his moment where he was also like, wait, I think I know her.
Well, because I heard my name. I'm like, what the fuck? Yeah. What's going on? And I was like, oh, hey.
Exactly.
And then like, I'm like, we're going to hold that. Something's going to happen right here. Cause like the cake was coming or
exactly. Yeah. Something was happening.
I can't remember.
Something
it was a whole
happening.
to do.
Yeah. It was funny.
It was, yeah. And it got worse as the night went on.
Oh my goodness.
That was the beginning of the night.
Oh my gosh.
It was just as a heads up.
They had a really good night then, I guess.
It was a good night. Lots of fun.
That's funny.
Well, what before you go, I think one thing that I would love to hear from you is, as we've talked a lot about your journey, your path, your ideas, how those have evolved. If a high school student is out there thinking, I think medical school sounds cool to me, medicine, but I have this itch for math and science. A lot of times the students are debating that's a decision that they have to make and not a combination that they can do. And one of those fears is I can't get into medical school without nothing but straight A's. And so if I take an engineering degree, that's going to be harder. And so sometimes they think that's a mutually exclusive decision. So what would you tell students about that process?
Yeah, not at all. Not at all. I would say medical schools are more and more looking for people who are going to push the field forward. And I think that anything that you can bring to the table that's in some way different is a huge benefit. Whether that's, you got an MPH, whether or not that's you're an engineer, or whether or not, whatever that is, they are really starting to value more than just the, straight biochemical, whatever, molecular biology background. And they still like those people. And if you do great research in those areas, that's wonderful. Sure. And you'll bring that onto medical school. But there's something so helpful in having diversity of thought in medicine. And so I would say 100% don't think that. I would say, do what you're passionate about, because you also do better in the things that you're passionate about. You excel in the areas that you're good at and that you like to spend time on. And whether it's medicine or whether it's engineering, you're going to be spending a lot of time getting good at your skill, whatever that skill is. And if you don't like that time that you're spending on it, then you're not going to do as well. So if you like math and science and you like engineering, pursue that. And, your passion for that will show through. And if you like medicine on top of that, great. There are so many ways to combine those two fields. So I would say do that, because that's probably where you're going to thrive. That's where you're going to shine, if that's what you're interested in. And would you maybe get a slightly lower GPA in engineering than if you had just done molecular biology? I don't know. I think I would have gotten a slightly lower GPA if I did just straight molecular biology than engineering. But that's because that's what I was interested in. Right. So make sure you're doing it from a place of interest, not from a place of your parents' interest, not from a place of your high school guidance counselor's interest. Get to college and figure out what is driving you. And this is something that's really hard. It's hard to understand how you learn best. It's hard to understand what do I really care about in the world, especially when you're in high school. We're asking a lot of things from high schoolers at a very, young age. Your brain hasn't fully developed by that point. And especially if you're a boy, definitely hasn't developed by that point. There's studies to show this. I'm not just saying this. Anyways.
Oh, it's true in every regard, whether it's a study or not.
Exactly.
We're all just little idiots until at least 35.
But it's a lot to ask, but you'll have to take some time when you're at the end of high school, beginning of college, end of college, whenever your turning point is for you, sit down and say, what classes did I like? What do I not like? What do I, how do I learn best? Maybe I like this teacher because they taught in XYZ way, not just because of their personality or something like that. And what classes did I do well in? What did I get an A in and it was easy? What did I get an A in, but it was really freaking hard and I worked really hard to do it and I liked it. I liked it a lot and I'm totally fine with that challenge. Some of the impetus is on the student to understand themselves. Nobody else can understand you like you can. And you just have to take that time to be introspective from time to time. You can get involved in all these different activities and things like that and run around campus constantly and have your calendar fully booked. But if you don't have the time for you, then you're never going to fully progress. And none of these experiences are ever going to really solidify for you moving forward. So yes, you can do engineering and you can do medicine. It's not a bad thing. Embrace it wholeheartedly if that's what you're interested in.
That's awesome. Well, this conversation has been an absolute pleasure and really educational. I mean,
Yeah.
there were many times where
so much.
Audrey and I were just like, we wanted to take notes. We're like, right, go on. Okay. So, and so that was fascinating. And two, I mean, you're just a complete joy. And it's been a pleasure knowing you for this long, seeing all the things that you did while you were here, keeping track of all the things you're doing afterwards and things you're going to do. Thank you so much for sharing your story here. I mean, I'm just thankful that I know you, let alone have had these interactions with you. So thanks so much for coming in.
Thanks for having me.
Yeah.
Really appreciate it. It was very nice meeting you.
Nice to meet you as well. Thanks for being here.
Yeah. Have fun.
Cool.
Thanks.
All right. I really liked that episode.
Jazzy Jazz. I don't think she likes that nickname or that is her nickname, but I call her that.
You just gave it to her.
I just did. From now on, Jazzy Jazz. My favorite part about Jasmine is the fluidity in which we went from silly things to just personal things to deep dives about neurons and how the brain works and how because in person you can see her she's not changing. It's not like she's flipping switches. She just knows all these things. And I think that sometimes to the layman, if you hear of someone being like a neurosurgeon or what they do and what they know, Jasmine's just a normal person who is just like any other. In high school was just like anyone else. Like, hey, I have a passion for something. I'm smart about stuff. I don't know what I want to do necessarily, but I want to go down this road. And she just kept following it.
Yeah. So Jasmine right now is in her residency at UCLA. And it was so cool to hear about kind of her journey from getting 2 degrees in engineering to an MD to now. And I remember at one point in this conversation, she said something along the lines of there's only so much I can fit in my brain, but you can tell she's the person who's really maximizing that. And, I think even as an undergrad, I experienced that sometimes. And she's the one who just kind of went through that and just kept going.
She's so different from our other biomed, pre-med Tracy. So different, but so extremely cool on the same level. But that's why I like these 2 episodes. If you haven't listened to that, going back and listen to Tracy Dooley, because someone who went to medical school, she went to Stanford Medical School, but took a completely different path. But I guess that goes to show that for someone looking that has interests in, biology, life sciences, engineering, and possibly medicine, there are so many ways to mix and match, to combo, to change your mind, to think about things in different ways, and still find lots of different possibilities on the other end. And the one common denominator there is that, when you study engineering as an undergraduate degree, that allows you this opportunity for your brain to develop problem-solving skill sets that are probably innate to you, but they get enhanced.
Yeah, absolutely. And I think for both of them, it's cool. I think engineering is probably the most flexible degree in my opinion, just because you can do so many things with it. But that being said, each of them at so many points, sort of had a set path for them. Graduate from a degree in a bachelor's degree in engineering, you could become an engineer. Get a master's, you could become an engineer. Get an MD, you can become a doctor. And each of them has kind of done with that really what they wanted and just kind of followed through on their passions and with different paths. And I think that's a good lesson in the sense of oftentimes we might think we're sort of locked into something because we already started it, but both of them have done different things. So
Totally. And I guess I'll use this opportunity as well because if I remember correctly, I ran into Jasmine at her mother-in-law's birthday dinner.
Yes, something like
And
that.
so it's just because we mentioned in the conversation, but I just want to apologize to that family again because they were next to a very rowdy group of about 30 people, and I apologize that we were that way, and we hope we didn't. She said she was very nice about it. She said we were fine, but I still feel bad about that.
You never know who you're going to run into at dinner.
Never know.
Okay.
Well, cool. Let's get it out of the way.